Hello friends, I'm Dr. Sandip Bipte, Oncoplastic breast surgeon working at Apollo Cancer Center in Mumbai. So friends, today we're going to talk about and discuss about the topic is a breast cancer reconstruction. And I think it's very important to discuss the reconstruction after the breast cancer surgery. As you know, the mastectomy rates are very high in the periphery because a lot of patients think that by doing a mastectomy, they will just get rid of the adjuvant treatment and they may not require the chemotherapy or radiation. But the fact is that it's not dependent upon the surgery, it depends upon the biological tumor. So it's necessary to explain all the patients who are undergoing a breast surgery or a mastectomy. We have to explain the type of the reconstruction. So there are basically two type of breast reconstruction which normally we tell our patient. One is immediate breast reconstruction, which means the mastectomies happen and simultaneously on table we do reconstruction. So this allows a patient to have a cancer surgery followed by immediate reconstruction, which will yield a good cosmetic outcome. And if you need to have something correct on other breast, we can do that. This is called as immediate breast reconstruction. The advantage of immediate breast reconstruction is the patient undergoes only one surgery, one anesthesia, and the outcome is the best because we are matching at the same time. And the cost factor is also important because it involves the same surgery will happen. The another type of reconstruction we call as delayed reconstruction, which means the patient finished the primary cancer treatment and this cancer treatment goes for maybe a 6 months to sometime a year. And after the 1 year, the patient will do a delayed reconstruction. The delayed reconstruction also, there are the pros and cons. But sometimes the primary treatment is prolonged and the patient chooses to have delayed reconstruction. The only disadvantage of delayed reconstruction is the patient may have the radiation, and then the radiation side effect has to go. The tissue elasticity has to come back. So we have to give good time to heal these all primary things, and then we can do reconstruction. Third type, nowadays we're talking about oncoplastic breast reconstruction. So basically, a small defect we can do it during the surgery, and this is by using a different technique. There are different techniques are available. By using our own breast tissue, we can close the small defect, and these are called as oncoplastic breast surgery. For example, one of the examples of the oncoplastic breast surgery is a round block technique, where we give a cosmetic incision and take out the tumor, and the cosmetically the breast shape is similar to the like before, or same as near match about the primary before surgery. The implants, and third thing is implants. So sometimes we use the implant based reconstruction or a pedicle based reconstruction. There are the two main ways we can use it. Either by using our own tissue, which is called as a pedicle, or taking the flap from the back or from the tummy or from the back side. Different flaps are there. We can take that. Or sometimes we can use implants. A third is we can use a combination of technique. We can use this combination technique to yield the cosmetic outcome. But all these things will decide by the breast surgeon and plastic surgeon, or sometimes we can choose this combined technique and depend upon how much the defect is the tumor defect and the patient availability. So all these factors assessment is required to give the good cosmetic outcome. So by doing this techniques, the patient will have almost near normal breast as before. This will yield a good cosmetic outcome to the patient, and patient live happily. Thank you.